economy and the pandemic, prospects and plans for 2021. Let's take you there.
So that businesses are going to be working with us as we deal with this whole matter of vaccines. The Minister of Health will outline precisely how we have gone about seeking to acquire these vaccines through the COVAX facility, through the African Union initiative, and through our own direct dealings with the producers as well as manufacturers. We believe that we've now reached a stage where we will be able to effectively defeat COVID-19, and we will only be able to do so if our people continue to observe all the protocols about COVID-19, which we have been talking about. But the vaccine is going to be a major boost to our efforts in fighting COVID-19. Some people have raised issues about the financing thereof, and finance is not going to be a problem because we will be able to pay for these vaccines as we order them. So I believe that the tasks that we now have to focus on are really fourfold for us as the African National Congress. The first one is to defeat COVID-19, and we will be talking about some of the strategies that we are embarking upon to defeat COVID-19. The second one is the economic recovery process, which we are going to deal with on the 28th under the meeting that will be led by the TG. And the fourth one is the renewal and the unity of the African National Congress so that it can be a properly strong engine to deliver on the economic recovery as well as to defeat COVID-19. And the fourth one is how we are going to create a better Africa and a better world. And already our country and indeed the ANC is at work in ensuring that we do many things that are going to create a better Africa and a better world. Comrade Chair, with that, I think we've got the scene set for us to engage with our people in this discussion, because it is an important platform that you have created, and we welcome it with both arms. And I have no doubt that the year ahead, much as it will be difficult, and much as there are going to be many challenges that we are going to confront, as the African National Congress, we have confronted many other difficult challenges in our history, and this is but one of those that we will be able to confront, and we will emerge victorious. Thank you very much, Comrade Chair.
Thank you very much,
President. I'm just looking if Comrade Gwede Mantashe is back. If not, I will continue. We've now reached a point in the program. Firstly, let me ask everybody to kindly put off their videos to enable better communication. Comrade Mantashe is back, and I'm going to hand over the chair to him to introduce Comrade Zweli Mkhize and Dr. Akina Tulare. Thank you, Comrade Mantashe.
I thought you would take it beyond that point. Comrade Jesse?
Chairperson?
Take it beyond that point.
Okay, I'm happy to do so.
I'm still breathing heavy.
Okay. Firstly, let me say thank you to the President for setting quite a good scene for the discussion and for the panelists, taking into account what the ANC's four primary tasks will be the defeat of COVID, and that certainly is task number one and priority number one for the next couple of months. Laced into that is the economic recovery process, which can only work very well if there is unity of the African National Congress and renewal of the ANC as a fighting force to support the people in our country, in particularly the poor. And of course, we don't live on an island, and therefore the interconnectivity with Africa to create a better Africa and, of course, a better world. With that having been said, I'm very happy to introduce Dr. Zweli Mkhize, or perhaps it's Dr. Patla. I'm not sure. I see it wasn't clear, and then followed immediately by Dr. Tulare.
Thank you very much, DSG. Indeed, it's Joe Pasha. Comrade Zweli is held up, so he has asked me to stand in for him. I hope I can be heard. My gadget seems to sometimes show me something else. Okay, thank you very much. I think the host has allowed me even on the video. Let me pass my greetings to Comrade President and all the officials of the African National Congress, national officials, and greetings to all comrades on the platform. Also greetings to the leadership of the PBF, the host of this discussion this afternoon. Indeed, as Comrade DSG has indicated, I'm with Comrade Dr. Tulare, who will make a substantive presentation just in terms of how we're proceeding with the preparation for the vaccine program. Just to recap briefly to say, comrades, it is now almost 10 months. In fact, just over 10 months since we've been in South Africa with the virus. In terms of the world, the virus was confirmed in January 2020, so it's more than 12 months now that the WHO confirmed the COVID-19 virus in China, in the Wuhan province. Our first case was on the 5th of March 2020, so just over 10 months from now. A lot of work, as comrades are aware, have happened, both at the broad national level with all our partners in the provinces, not only at health, led by our president. From the health side, our task was to prepare the health platform so that those who need healthcare can be catered for, but also run an awareness and a screening campaign and testing campaign. Now, the lockdown, as President mentioned earlier on, during the course of middle of March, right up to June last year, gave us a time to also prepare additional capacity within the health facility and do much more screening and testing. Now, our first peak for the first wave was around July, differing in different provinces, but largely around July and August. We were able to sustain that situation. In some provinces, it almost overwhelmed our health facilities. In the Western Cape, in the Eastern Cape, Gauteng prepared. At some stage, we thought we were going to be overrun also in Gauteng and also in KZN, but we managed through that first wave. And the peak started declining around September, October, and as we started November. And we thought we were going to have sufficient breathing space. We thought from the various epidemiological projections that we will probably only have the risk of a second wave around January 2021. But to our surprise, mid-November, we started seeing flashes of a high rising of infections in the Eastern Cape, starting in the Nelson Mandela Bay, and quickly spread into the rest of the Eastern Cape, and also going into the Garden Route and most of the Western Cape. And now, since December, this has now spread through to the rest of the country. And during the middle of December, it has spread sufficiently for us to actually declare that indeed we were now in the second wave of the infection. And of course, the festive season did not help with all the movements of people from the inland into the coastal areas, from the industrial areas of Gauteng, Cape Town, and eThekwini, and Nelson Mandela Bay, and Buffalo City, moving into the rural areas. All those movements did not help in terms of spreading the virus. In terms of how we have progressed at the current moment, can I just ask Dr. Tulare just to go back to the curve, which depicts quite clearly the way in which, as we now got deeply into this second wave. I think this graph clearly just depicts in terms of the way this second wave has been actually spreading, with the green showing us the average 7-day average of the new infections, and with the blue line showing the hospitalizations, and the red line showing us the deaths. Now, as we see on the left-hand side, that graph shows us the first wave, which, as I said, that peak was November to August 2020, and then it declined. And then we had quite a bit of plateauing of the infections for quite some time. And then, of course, came November, towards the end of middle of November, and then the rise of the infections, as I said, starting in the Eastern Cape and rising. And as we can see, whether we're talking about the number of new infections, whether we're talking about the level of hospitalization, and also the number of deaths, we can see that where we are, as we reached our tall peak there, just as we went towards January, that is much higher than the peak which we reached during the first wave. Now, at least the promising thing now is that while many of our facilities get quite stressed in the main provinces of Western Cape, Eastern Cape, but we were not totally overwhelmed by the infections. But as it's been spreading to all other provinces, we know that even provinces like Limpopo has now become number 4 in the rise of infections on the daily average infections, and our health facilities have been struggling. But the good thing is that over the last 7 to 10 days, you can see also on the graph there that there's a small downward trend at the end. So there is a promise in the sense that in the last few days, from the high peak of just under 22,000, 21,000, 20,000, 19,000, over the last few days, we have also recorded just below 10,000 infections per day. Now, Comrade Akwana Tulare will speak more in terms of, as we know, we've been intervening in terms of the prevention methods, the hand hygiene, cough etiquette, social distancing, sanitizing, avoiding crowds. But from the second half of last year, we started, as the world started moving towards investigating possibilities of vaccines. We also joined in looking at possibilities of how we could access the vaccines, largely talking to colleagues within the WHO, but also talking directly to various pharmaceutical companies. We joined the COVAX initiative of the WHO, and even towards the end of last year, were able to pay the deposit into the COVAX. And now at this stage, as Comrade Akwana Tulare will indicate, we are actually on the verge of completing the contracts through which we will be able to receive our first consignment of the vaccines before the end of January. And we are preparing to receive more stock in the second quarter of the year, third quarter, and right up to the end of the year. At this stage, Comrade Chair, I will want to give over to Dr. Tulare to take us through the presentation. This will give us more detail as to how we're preparing for the rollout of the vaccine. Over to Dr. Tulare. Thank you, Comrade Chair.
Thank you, Comrade Chair, Comrade President, the national NOBs, comrades and colleagues, thank you very much. I'm going to present the framework that has been adopted for the implementation of the vaccination in the country. And the framework consists of 5 pillars. The one pillar is on governance, on communication, on how we are prioritizing and allocating the vaccine, including on distribution and issues around administration and safety and effectiveness. We touch briefly on some issues around regulation, and then we also touch briefly on some issues around budget consideration. I'm not going to go very deeply into the issues of budget and finance, and I can just touch on it briefly here to indicate that the COVID vaccine is regarded as a public good, and financing is going to be mobilized from multiple sources, but predominantly from the fiscus, and there will be some other mechanisms of supporting the budget through participation of, for example, medical schemes, and also through the participation of business sector in providing support to the budget. So if we look at the principles that we are following in procuring and distributing and allocating the vaccine, must I start my video? They say I must start the video. We are looking at a vaccination in order to prevent morbidity and mortality in our communities and to achieve what we call herd immunity or population immunity, and to prevent ongoing transmission. Our target for herd immunity is 65%. We would like to see 65% of the population vaccinated so that we can have population immunity, and this will help us to prevent ongoing transmission. This advice is coming also from the Ministerial Advisory Committee on Vaccination that has conducted various exercises of modeling to understand what will be critical for us to reach that population immunity. The other key principle here is that South African government will be the sole purchaser of the vaccine for the country, and the Department of Health will contract with suppliers to purchase stock and allocate to the various role players, either in the public sector or in the private sector. The reason for government being a sole purchaser is because there is scarcity of supply globally, and the negotiations are quite complex, and they require that the engagements happen at government to supplier level. This will also ensure that we achieve some of the key principles of moving towards a universal health coverage by ensuring that there's equity in acquisition and distribution of the vaccine in the population. Because of the limited availability of the vaccines globally, it will be necessary for us to procure available stock from different manufacturers, and these manufacturers are currently positioned at a global level. And this will result in us acquiring different types of vaccines. So we call them multiple vaccines in the program, and it might be a single dose vaccine or a 2-dose vaccine. And if ever you get a single dose vaccine, you cannot interchange it for a 2-dose vaccine. So it's because of how the availability of vaccines is unfolding globally. And allocation of the vaccines will be to various priority groups, and this also addresses the principle of equity and efficiency in allocation, and this is going to be guided by the Ministerial Advisory Committee on Vaccines. The vaccination system is going to be based on what we call a pre-vaccination registration system, meaning that all of us will have to get into a register of some sort so that we know who is going to be vaccinated, where are they going to receive the vaccination, and which dose are they going to receive. This vaccination, pre-vaccination system will help with that. And there'll also be an appointment system for vaccination, meaning that once you have registered, There'll be an allocation of the site at which you are going to be vaccinated. And with this, it means that, we'll be able firstly to control how many people visit a vaccination site and how many vaccines should be allocated to that vaccination site. And it will also help us to manage those that are expected to come back for the second dose of the vaccine. As I've indicated, all vaccinated persons will be on this national register and will be provided with an electronic vaccination card. The leadership and coordination of the vaccination will be led by the Interministerial Committee on Vaccinations, as Comrade President has indicated in his introduction, chaired by the Deputy President. And the role of this Interministerial Committee is to ensure that the 40 million South Africans who are going to make up the 65% that is needed for herd immunity are vaccinated. We'll also have what we call the COVID-19 Ministerial Advisory Committee that will be advising the Minister on technical and other issues. We've got the Ministerial Advisory Committee on Social and Behavioral Change that will drive a concerted social mobilization campaign to all sectors. And then at an operational level, we'll have a National Vaccine Coordinating Committee, and it will be tasked with leading the National Vaccine Scale-Up Program. And also it will work with the provincial health departments who will have provincial vaccine coordinating committees, as well as the private sector and other stakeholders such as civil society and any other identified role players. We'll also have a private health sector coordinating committee that includes medical schemes, the Hospital Association of South Africa, Independent Practitioners Association, retail pharmacies and groups, specialist associations, nursing associations, other health professional associations, logistic providers, pharmaceutical manufacturers, employers, and business represented in this private health sector coordinating committee. What we want to highlight here is that in terms of what the MEC on vaccines is advising, taking into account that vaccines are not going to be available for everyone immediately, and that there needs to be a system of prioritization that will allow us to distribute the vaccine based on what we have at hand. What the MEC has advised on is in terms of prioritization, that we need to prioritize those that are in roles that are considered to be essential for societal function, and I'm going to clarify this in the next few slides, and those that are most at risk of infections and who are facing serious outcomes, for example, if they get infected, such as those that are above the age of 60 or those with comorbidities and those living in overcrowded settings. We also look at those that are at most risk of transmitting the virus to others as one of the categories that are going to be prioritized. In terms of how the vaccination is going to be conducted in line with prioritization, we are going to have 3 phases. Phase 1, which is going to be starting towards the end of the month, beginning of February. It's where we are going to be looking at healthcare workers in all their permutations, whether they're in the Department of Health, whether they are in the military health services, whether they're in correctional services, in all their permutations, whether they work for the municipalities. And we are targeting a population of 1.25 million. This will also include traditional health practitioners that are also in contact with people who may be infected, or they may also be posing a risk of transmitting the virus if they are not vaccinated. Phase 2 is going to include what we call essential workers and persons in congregate settings, such as those that are in homes, in correctional service facilities. We are going to be looking at persons who are above 60 years. We are going to be looking at persons above 18 years, but who have got comorbidities. And those are the numbers that we are looking at. And then in phase 3, we are going to be looking at other persons that are above 18 years of age, and the target population is about 2.5 million. And then in breaking down further, who are the healthcare workers, the categories, we look at category 1, those that are conducting aerosol generating procedures, meaning those that are working in ICU, in theater, who are using monitoring, working with ventilation machines, and those that are taking specimens for COVID. The second category is those that are in direct contact with known or suspected COVID-19 cases. Those in contact with patients is category 3, and those with some limited contact with patients. And this category 1 to 4, we call it category of those that are in contact with patients. And then category 5 is those that are not in contact with patients. In phase 2, we have indicated that it will be essential workers, people in congregate settings, persons above 60 years of age, and persons older than 18 years with comorbidities. Just to highlight that essential workers would include teachers, police officers, persons in the military, people in the mining sector, and in the security industry, retail, food, funeral, undertakers, banking, essential municipal and home affairs, border control, and port health services. In congregate settings, we are looking at prisons, detention centers, shelters, and care homes. In addition, people are in hospitality and tourism industry, and those that are in educational institutions that are also regarded as at a risk. And then comorbidities include those that have got HIV, tuberculosis, diabetes, chronic lung diseases, renal diseases, obesity, etc. In terms of the approach that we have taken in selecting the vaccine, we have got 6 key considerations that we have taken into account. Firstly, that the supply of the vaccine must be secured and it must be sustainable. So we call it supplier capacity. And that the vaccine must demonstrate features of safety, efficacy, and it must be able to induce immunogenicity, meaning that you must be able to demonstrate that it can stimulate your antibody response or your cellular response so that you can fight the virus as you are exposed to it. It must be easy to use and easy to schedule, including the number of doses required. It must demonstrate stability during storage and distribution, and it must be cost effective for our country. And it must also have received a regulatory approval through the South African Health Products Regulatory Authority, either in the form of full licensure or in the form of emergency use authorization that SAPRA is able to conduct. So it's a combination of these 6 considerations that has been taken into account as we select the vaccines, but taking into account the issue of availability as well. We have looked at various vaccines as of this stage. For example, the first vaccine that we have looked at, it's the one that is produced by the company called Pfizer and BioNTech vaccine. It has received regulatory approval in the EU and by the FDA in the US, including WHO. SAPRA filing is still currently being finalized, but it's almost concluded. This vaccine is more than 90% efficacious, and then it's a 2-dose vaccine. The rollout has already happened in various countries, and where bilateral deals have been signed with each of those countries. The issue that creates complexity around this vaccine is that it requires storage at -70 degrees, which may be a limitation, but we understand that our capacities in the country in terms of logistics and storage will be able to meet the requirements of this vaccine. And then the other vaccine that we are looking at, it's the vaccine that is produced by AstraZeneca in partnership with the Oxford University. And in terms of regulatory approval, it has been approved in the EU and in the UK. And its efficacy, it's 70%, and it's a 2-dose vaccine. Further work is currently being conducted on this vaccine to ensure that the efficacy is monitored and it improves we are informed that there's research on efficacy and studies that are currently ongoing that may yield a better efficacy in the near future. AstraZeneca has outsourced its production to various sites globally, and the site that we're interested in is called the Serum Institute of India. It's the site that we have engaged on discussions with, and they have indicated that they are going to be giving us our first consignment of vaccines of around 1.5 million doses that will start rolling out on some of the prioritized categories of recipients of the vaccine. It's likely that this vaccine is going to be used widely globally, and especially through the COVAX facility, and it uses a tiered price model that is quite affordable. What is also encouraging about this vaccine is that it does not require a stringent storage temperatures. You can store it at a temperature of 2 to 8 degrees Celsius, and it's very, very doable in a lot of developing countries. There are other vaccines that we are looking at. It's Johnson & Johnson. In terms of the regulatory position, the product is in the process of being approved. The dossier has been submitted. It's a single-dose vaccine. You'll recall that I had said that it could be a single-dose, a two-dose vaccine. Johnson & Johnson is a single-dose product, much easier for administration and also more cost-effective. What is also interesting about this product is that it will be manufactured. Johnson & Johnson has partnered with Aspen, and it will be manufactured in the Aspen facilities in the Eastern Cape on a contract basis, and it will be supplying many countries, including our country. And then there's another company that we just want to highlight called Moderna. It has received a regulatory approval in the EU and by the US FDA, although colleagues, if ever you have been watching in the news, there had been some concerns around this vaccine. It's a two-dose vaccine. Storage is at minus 20 degrees Celsius, and they do not have an office here in South Africa, and we don't know if ever there's an intention by this company to submit their dossier to SAPRA for evaluation. But we have had various discussions with this. Just to also indicate that our discussions with some of these companies that I have highlighted started as far back as September, and the discussions were quite intense. There are lots of conditionalities that these companies required, but we think that we're at that stage where we have had some breakthroughs, especially with AstraZeneca, as I had indicated, and also with the Pfizer vaccine, where at an appropriate time, the announcements will be made on how much progress have we made in these. The other issues around regulatory issues is that SAPRA looks at whether a vaccine is safe and effective, and this is in line with what is contained in our Medicines and Related Substance Act. And our South African Health Products Regulatory Authority has put in several measures to ensure expedited approvals of safe vaccines, including working with other regulators where there are agreements such as in Europe, in the US, in the UK, and this will ensure that we expedite the approval processes. We are also looking through SAPRA at a priority review approach for all COVID-19 vaccine applications. And so if ever there's an application, it receives a priority review. And there's also another measure that has been taken into account where there's flexibility in relation to labeling and packaging requirements, meaning that if a vaccine, for example, is labeled in English, then we do not have to change the labeling. And then we'll look at the other vaccines that are labeled in other languages and make sure that they are labeled so that we can use them. Exemptions of medicines by Minister of Health from certain requirements is undertaken in this instance. And then the other area that has been taken into account is to ensure that we are able to authorize in terms of Section 21 of the Medicines and Related Substance Act, where manufacturers have not yet submitted a dossier, but you can approve on an emergency basis the use of that product. And the Department of Health has meetings with vaccine manufacturers who are also encouraged to submit dossiers for those that have not yet submitted dossiers. So these meetings take place on a regular basis. And in terms of how the vaccine is going to be procured, this will be governed by the Public Finance Management Act and the Medicines Related Substance Act. Emergency procurement procedures for vaccines and service providers in logistics, training and communication, and human resources are currently undertaken where no contracts are available. There's been a request submitted to the National Treasury for deviation from normal supply chain processes for vaccines so that we can be allowed to procure even from a limited number of manufacturers without being penalized for not seeking as many manufacturers. And this is precisely because of the scarcity of supply of the vaccines. And it's also, procurement is also governed by registration with SAPRA and approval by SAPRA. So the competitive bid processes it will be based on registration status, availability of stock, and cost effectiveness with shortened time frames for this process. For the distribution of the vaccine will arrive in the country as through the purchaser, which is government. It will come into the ports of entry, and then an identified distributor will distribute the vaccine to centers where vaccination is going to be undertaken. For healthcare workers, the vaccine storage and distribution will be managed through a mechanism that is agreed upon. It might be outsourced, or it might be through some other mechanism of PPP, but it will be a central distributor. Vaccines that are acquired through the COVAX facility, the storage will be outsourced and distribution will also be outsourced, but this will be done also through a central distributor or through contracted distributors using a competitive bid process for the contracted distributors. And then for contracted vaccine suppliers, the supplier will be responsible for storage and distribution in line with good pharmacy practices and maintenance of cold chain, and it will be delivered to the identified vaccination sites. And you can see that on the right of this slide, we identify the sites that are going to be used for vaccination, either in the public sector or in the private sector. And I'm going to just touch on this briefly in next slides. The other area that we want to highlight is that because of the scarcity and the importance of this good or public good that we are going to be administering to our population, we want to ensure that there's security in the distribution of the vaccine, and therefore it will be expected that those that are going to be distributing must have vehicle tracking and monitoring, and this must be supported by our security agents. In terms of where the vaccine is going to be administered, meaning the administration sites, we will be deploying the SAPS and the SANDF to those sites to make sure that we secure this vaccine. The vaccines are going to be trackable and traceable, and we are going to use a barcoding system, scanning system to do this, meaning that we will have to make sure that we know where each and every vial is going to be used, and this will be through this scanning system. And what this also implies is that as it is distributed to the various sites, we would know how many vaccines have gone to a site and how many vaccines have been used and how many vaccines have not been used. So it's through this data verification system that we are going to be employing. Vaccines must be disposed of in a secure fashion, and we must also ensure that we monitor that there is no wastage of the vaccine. In terms of phase 2 and phase 3 distribution, we are going to use various sites such as health facilities, vaccination centers, outreach vaccination programs, and work-based vaccination programs. And we have identified examples of categories that are going to be vaccinated in each of the sites. I'm not going to go into detail on this one. There's a need to balance vaccine rollout with ongoing provision of essential services. So what we are implying here is that we do not want to see the vaccination program impacting negatively on the other services that are to be provided, whether it's childhood illnesses, maternal services. They have to be maintained. And what we are also looking at is to ensure that health facilities and the outreach teams will shift to providing services to other target groups as well. And vaccination centers instead will be required to play a larger role so that additional sites of vaccination can be established. This may include in pharmacies, independent or pharmacy groups, in mass vaccination centers in urban areas where we can either vaccinate individuals or groups, and other settings that will be identified. What is important is that these sites are going to be required to register and to be accredited for compliance with cold chain and other requirements for vaccine distribution. And what is also important is that in terms of the administration of the vaccine, we want to ensure that the safety essential considerations form an essential component of the administration program, and they underpin the acceptability of the vaccine. We want to ensure that there's vaccine confidence and that people are confident in the vaccine that is going to be administered, and that we are going to do this through transparent and effective safety surveillance and causality assessment. We are putting systems for this, including the electronic reporting system to collect some variables required for adverse effects for vaccination, for immunization. It's a system that we use even for other vaccines, but we are going to be elevating this so that we can monitor any adverse effects that may result out of administering the vaccine. The SAPRA is going to implement what we call a yellow vaccine card system that is going to be adapted for our country for active surveillance of the vaccination program. There is another system that they are going to implement called the Med Safety app for electronic reporting of all adverse events following immunization as a method for passive surveillance, and it will ensure availability of reporting tools and reporting lines, which would facilitate what we call causality assessment. I am expanding on this because I think in the questions, there was some questions that related to whether we're going to be monitoring the adverse effects of vaccination. What I also want to indicate is that for the vaccination program, wherever we are going to be vaccinating in the sites, there will be teams of health professionals that will be ready to manage any adverse effect that may arise out of vaccination, including ensuring that there's resuscitation kits and there's the appropriate skill that can ensure that we do not subject the population to adverse effects unduly, and if ever there are adverse effects, they are managed immediately and actively. The surveillance system will enable data sharing between the various role players, including SAPRA, Department of Health, and the WHO. And what is needed in terms of the data that we're going to be collecting to monitor the vaccine uptake and coverage and prioritization, planning, safety, monitoring, and vaccine effectiveness studies is a system that we are implementing. And this system is called the Electronic Vaccination Data System, and it's in the process of being finalized. It will leverage off existing systems which are currently deployed and implemented at scale, whether it's in the public sector or in the private sector. And this electronic vaccine data system will support collection and provision of the following information. Firstly, patient information, including demographics, number of doses, health establishment information, the name and type of facility, the vaccine administered, in line with also what I had identified previously on the coding. This coding will give us the manufacturer, the batch number, etc. And it will also provide us with safety information as part of the pharmacovigilance plan, what I called the adverse events following immunization, and a record of vaccination issued to individuals where appropriate. So this system is already in the process of being developed, and we're working with various role players to ensure that this system is deployed before we start with our first vaccination program, expected towards the end of the month or beginning of February. And the data, I'm not going to be delving too deep into this slide, but just to indicate that the system will have a dashboard, and this dashboard will be viewed on a daily, weekly, and monthly basis to give us the information that we are collecting. And also importantly is that we have to have a very effective communication and demand creation plan that will ensure a coordinated effort in communicating issues around the vaccine, ensure that all eligible groups receive the vaccine with confidence, that all people get the correct information, and we manage the misinformation, disinformation, myths, or misconceptions. We also manage through communication hesitancy of the public, and provide correct, consistent, and timely information on the new vaccines in terms of availability, safety, and timelines. And then must generate awareness and understanding of the phased approach, and understand low-risk perceptions of the infections amongst people, and build an enabling environment to adapt and maintain COVID-appropriate behaviors, including non-pharmaceutical interventions, and mitigate misconceptions and adverse events, and build public confidence. At the beginning of the presentation, we had indicated that there's a Ministerial Advisory Committee on Behavior, and together with the other entities that are responsible for communication, whether it's the government communication and information department or other role players that work with GCIS and the Department of Health, they will be required to drive this exercise, because if we do not do this exercise, we may even undermine our efforts of getting buy-in from our communities. I just want to end the presentation by highlighting an issue that we picked up in the questions around ivermectin, and some concerns around it, and anxieties around why it is not implemented. Firstly, we want to indicate that ivermectin is a host-directed agent and a broad-spectrum activity, has got broad-spectrum activity against many RNA viruses in vitro. However, what we are also saying is that it works as by reducing viral loads, by inhibiting the key cellular processes that the virus hijacks to enhance infection and suppress the response of the host. There have been no positive recommendations at this stage for the use of ivermectin in the management of COVID-19 infections by any regulatory authority, such as the US FDA, the European MA, and the British regulator. So what SAPRA has got relationships with these entities and has looked at the work that has been done around ivermectin, and this is the position that we are at this stage. Also, thirdly, is that the WHO does not currently recommend the use of ivermectin for the treatment or prophylaxis of the virus. And we also know that there is no clinical trial applications that have been submitted to SAPRA for review on ivermectin at this stage. And as of the 22nd of December, ivermectin has therefore not been approved by SAPRA for use in humans. And there is no confirmatory data available on this drug as yet for use in the management of COVID-19 in humans. And in terms of the safety and efficacy of this agent, there is no evidence at this stage to support the use of ivermectin. And then SAPRA, as I've indicated, has not received any applications to register ivermectin for human use, either as a prophylaxis or as a treatment. But SAPRA has committed to fast-track any review that has been submitted to it as an application, should it be submitted. As I've indicated at this stage, there is no application that has been submitted. And SAPRA is encouraging and supports well-designed, ethically approved scientific studies, and will continue to evaluate any emerging peer-reviewed publication or data on the use of ivermectin for the treatment of COVID-19. And what SAPRA is aware of is that according to global clinical trials that have been registered, there are few trials that are currently underway in Egypt, where there's 1,370 subjects, Brazil 857, USA 740, and Japan 240. And SAPRA is monitoring how these trials are currently unfolding, and at the appropriate time, when there's sufficient evidence, they will pronounce on their view of the clinical trials. And SAPRA will also consider enabling access to approved formulations of ivermectin intended for human use, including through Section 21, meaning emergency approvals, provided such a request is supported by evidence. That's my submission. Comrade Chair and Comrade President, leadership, thank you.
Thank you very much, Dr. Tulari. You certainly took us through the journey of why we need to have a seismic shift in our behavior. You've introduced the aims of the vaccine, the fact that it must be safe and effective, how it will be allocated and who makes the decision about allocations, the establishment of an IMC, the relationship with private health sector and the coordinating committee, the prioritization of the vaccine, who will be prioritized first in a three-phase approach. I would now like to hand back the chair to the chairperson of the African National Congress, Comrade Gwede Mantashe. And I'd also like to thank Dr. Patla.
Thank you very much, DST President, Secretary General, TG. I've listened to the TP here. All of you who are here. We're getting to the panel discussions now. What we're going to do is to give each panelist a maximum of 5 minutes, a maximum time of 5 minutes for introductory remarks. Then we open up for questions and comments. The panelists are the CEO of the Black Business Council, Khaki Mataban, Khaki Kaupamsa Gabon. Raise your hand, Khaki Babon. There he is. That is the CEO of the Black Business Council. Then we're having Bright Kongwana, who is the chairperson of the Youth in Business South Africa. Where is Bright? Bright?
I'm here.
Okay. And we have got Mr. George Sebulela. The South African United Supulela.
I'm here, Chair.
Okay. He is the president of the South African United Business Confederation. Lastly, is the president of African Women Chartered Accountants.
Afternoon, Chair.
Well, I support.
Chair, you should see me up on the screen.
Oh, okay. Those are the four panelists. Sabaniga in that order. Just put your grabs in the first 5 minutes and agitate all of us to raise questions after that. It's an opportunity. Thank you very much. Thank you.
Thank you very much, Chairperson, President, the leadership top 6, President. Thank you very much for inviting us to this. And also thank you very much to the PPF for hosting this event, specifically to Sasha and Sipo. I'll be very, very short, Chairperson, to save you time. The first one is, my questions will sort of be related, but the first one is about Black economic empowerment. As you all know, there's a Black Economic Empowerment Act that was passed by government, and related to that, there's a BEE Advisory Council, and the BEE Advisory Council term of office ended in 2019 October, and that Advisory Council was supposed to advise government on BEE, Black Economic Empowerment. So I think the challenge that we are seeing is that when people see that the appointment of the council is not happening, they start to think that perhaps maybe government does not necessarily take Black economic empowerment serious. And I think hence we have seen during the PPEs and when we were fighting COVID that there were some other elements who wanted to even take us to court and take government to court, especially taking the Minister of Tourism to court regarding BEE. So our appeal is that if the president can just appoint the BEE Advisory Council as soon as possible, because we've spent more than a year now without the BEE Advisory Council being appointed. And then relating to that is the issue of the value chain opportunities. We do have members who are young people, women, and people with disabilities. And we have seen during the procurement of the PPEs that there have been some people who have been opportunistic in registering companies today and getting opportunity tomorrow. So our appeal, I think, again, is that let's maybe use companies that are registered by SAPRA only, companies that have been around. We do have members who are in the sector. We've got medical doctors and so on. We've got companies that are properly registered. So when there are these value chain opportunities that are going to arise, for example, for distribution, administration, logistics, it's important that we do not forget the Black economic empowerment in that process. We ensure that companies that are owned by young people, by women, by people with disabilities are also afforded opportunities. And my last point, Chairperson, is that there's been a perception created in the market that government does not have money to fund the acquisition of this vaccine. And I think that, in a way, puts government in a bad light, that government cannot afford a public good such as this, which is very, very important. So perhaps maybe we need to find a way of coming with a communication mechanism that then goes a long way to deal with this perception and say, our government is not broke. Our government can afford to provide a vaccine for everyone, and then let's then deal with that perception so that people must have confidence in government, that government has got enough resources to provide public good for all of us. Thank you very much, Chairperson.
Thank you very much, George.
Chair, thank you so much for inviting SAUBC. The President of the ANC, His Excellency Cyril Ramahosa, and the office bearers of the ANC, it is indeed a great pleasure to communicate and talk to you today. The convener of PBF, Sasha and Sipombele, whom I think they're doing quite a very good work. Thank you so much for inviting us, and the team that works with you. I want to take 1 minute just to introduce the South African United Business Confederation very quickly. We are a confederation that is made up of over 66 member associations, over 900,000 businesses. We export over 20 billion goods on behalf of South Africa, export goods in many other countries of the world. We employ over 6 million employees. And our vision is very simple, is to make South Africa to become and be the preferred investment destination in the world. Second thing, the goal of SAUBC is none other than to contribute to the self-sustained development of our beautiful country, in ensuring that the majority of the lives of our citizens is bettered. And we know those majority of those people. And we decided to strictly say the Export Council, the Industry Association, and the chambers are going to be our members to come together as one on behalf of South African business. Now, I need to share, after listening to a detailed presentation from Dr. Tulare, which I thought is very well thought. I, however, want to share with the leaders of the ANC that we have the elephant in the room that we have to deal with very quickly. The current representation of NEDLEC is something that we have to consider very quickly if we have to deal with challenges such as the COVID and so on and so on. Because unless we believe that the NEDLEC as it sits from 1994 until to date represents the majority of the business, then we have a problem. Because we can't talk to the few and think that we are dealing with the situation. The more inclusive it becomes, the better all of us who are committed to make South Africa to become a better country, we are sitting around the table and be able to deal with this situation. And I echo the sentiment of our president, our lovely president, when he says the economic recovery plan was crafted by all social partners. In our position as we sit today, we say, no, we were not part of that social discussion. And this is one of the largest business organization in the country. I, however, want to echo that the presentation as they were made by various individuals, they are of a nature that I think a lot of people have taken a lot of effort in dealing with this pandemic, and we appreciate the work done from those individuals. I also want to implore that in the process of the value chain of this vaccine, let's not fall short and repeat the same mistake again that we have seen with the PPEs in ensuring that the procurement policies that were crafted in this country are followed to the teeth. Because what we don't want to see is to see already identified suppliers before even the process begins. and that will unjust the majority of our people as they sit in various organizations. And I would also encourage that as we formulate committees of various structures within the health sector, let's make sure that we make it more inclusive, such that the execution of the strategy or the plans that have been done are effective in ensuring that we achieve the results that we want to achieve. With those few words, I would like to say thank you again. We are committed and we will play a role, but however, we would like to see acceleration and invitation to make sure that we make the most important structures of the country to be more inclusive. Thank you very much.
Bright.
Thank you, Chair. Mr. President and the leadership of the African National Congress, the guests, both local and international, I humbly greet you. I am Bright Mtembeni Hlongwane, the founding Secretary General of Youth in Business South Africa, an organization aimed at creating more job makers and less job seekers. I'm also the Managing Director at Isimangaliso Group, a property, consulting and energy company. I'm here representing over 17 million young South Africans. Mr. President, the three things that young people need are: one, opportunities. As we have heard that there are going to be various opportunities presented through the vaccine rollout, the playfield must be leveled. Two, resources. Young people need resources to ensure that they maximize best use of these opportunities. Three, trust. You and the ANC need to trust young people with leading and taking South Africa forward. Namibia has Minister Emma Theophilus, who's aged 23. Mali has Minister Kamisa Kamara, who's aged 35. Zimbabwe has Minister Kirsty Colventry, who's 34. Botswana has Minister Bukholo Kenewendo, aged 30, to name a few. When should we expect to see a minister or deputy minister under the age of 35 in the Republic of South Africa? We also need the National Youth Fund, a fund which would be administered by the NYDA to ensure that all those young people whose businesses were not being able to be assisted by the various funds have access to funding. The funding also will help young people in the arts, science, and technology businesses. And there needs to be at least a minimum of 500 million to that fund. The NYDA alone is not enough to cater for all young people in South Africa. Also, we need an urgent convening of the Presidential Youth Working Group. The young people need a platform to share their thoughts, opinions, and ideas on fighting COVID-19 and rebuilding South Africa. At YIPSA, ours is to ensure that young people build thriving, sustainable businesses that make a significant contribution in the South African economy. We cannot do that without the support of government, business, and civil society. Also, on the 1st of June 2020, we wrote a letter to your office. Unfortunately, we never got a response. The letter emphasized on three things. One, we must move from a mere consultation to participation and empowerment. Two, we must institutionalize youth participation. Three, there must be a promotion of broader inclusion of young people. We cannot talk about sustainable development without the inclusion of young people in decision-making circles. There needs to be a strong investment in young people. And when we give young people political weight, negotiating muscle, and real influence in the world, they will create a better future. They all say nothing for us without us. In conclusion, Mr. President, the entire top six, the young people have asked me to share this with you, that one, they are capable, they are very skilled and capacitated. Two, they are ready, available and standby. Three, they will definitely take South Africa forward. I thank you.
Thank you very much, Bright. Zama.
Thank you, Chair. To the President of the ANC, Comrade Cyril Ramahosa, the top six, the PBF conveners, Dr. Tulare, for a very informative presentation. The attendees online with us today, I greet you and I say good afternoon. My name is Zama Kanyile. I represent the African Women Chartered Accountants Forum. So we're organization established in 2002, the main purpose of which is to build formidable ethical leaders that have the chartered accountancy profession that we can then deploy into senior positions, both in the public and the private sector. So I am excited that we are able to be part of this engagement and lend our thoughts on the vaccine rollout plan that has been presented. So when people say that they cannot find, these women to take up positions, because even this rollout is very aggressive in terms of the short timeline, considering the 40 million plus people that must be reached within a reasonable amount of time. And the coordination and oversight over such activities, ensuring transparency and compliance with corporate governance is going to be key, so that we restore public faith in what government is doing in the healthcare sectors, and we're not marred with scandals that we see or saw rolling out from the PPE rollouts at the beginning of the pandemic. So in short, what I'm saying is that the AWCA has these women. People say they can't find Black capable females to crowd in at the table or to borrow in terms of their minds and their thinking in terms of innovative ways that we can take South Africa forward. We say we debunk that. We have a database that is rich with a lot of women that are ready to put their services in the public sector. Chairperson, in my day job, I'm a fund manager at one of the government agencies, being the National Empowerment Fund. And what I've realized around this is that there are a number of opportunities in terms of the value chain in delivering and rolling out the vaccines. So it would be important to make sure that Black business owners are part of these value chains, and more so Black female entrepreneurs are included in this rollout. And one would imagine that these entities themselves would face some working capital constraints and perhaps have some capital requirements in order to support governments in this public-private partnership in rolling out the vaccines. So I urge government to think about how really we can think innovatively about the type of funding mechanisms that will allow Black entrepreneurs to participate, because the vaccine rollout in itself is a business activity. There's finances involved, and wherever there's a rand to be spent, we want to see that a meaningful portion of that is going to Black people and also to Black females. So with that being said, we put our hands up to support the government in their rollouts, being led by the ruling party, being the ANC. What I wanted to put forward and challenge also to our leaders who are listening in is the reaction of rolling out this plan and buying it and importing it, just like we've seen most of the PPE purchases were imported, is quite disappointing. Whilst we have to do that as a short-term measure to ensure that we don't lose more lives of our South Africans, I urge government to think around a long-term strategy about investing in venture capital and making sure that we've got the critical skill set within South Africa and we develop our own IP around healthcare so that we are more responsive and not so sharp. Thank you.
Thank you, Sasha. Will you be fielding questions?
I will, Chair. Thank you.
Please do that.
We have quite a few questions that have come through, in fact, over 117. Many of these are related to the economy and economic recovery. As mentioned before, we will be having a separate engagement on that on the 28th of January. Don't worry, your questions are noted and they will be kept. This specific engagement is on the vaccine rollout and the economy regarding to that. So we've picked some of the questions around that. The first question is from Anderson Gubahi. The slide, and I imagine this is to the Deputy Minister of Health, The slide on the vaccine rollout on its bottom end shows that it was adopted from the US Department of Health. This is worrying because SA dynamics and social factors are different to the US. My question is, why are we adopting a US methodology on the vaccination program and not adopting our own tailor-made program in order to meet our own challenges? That question is for the Deputy Minister.
Oh, okay. I was waiting for guidance as to whether we take question by question or whether there will be many. But maybe just because you have asked me to respond to that one, I think maybe the participant might have missed something on because there is no way where we said that our plan is based on US information or on sort of copied on the US plan. I'm not sure. They might have seen where it's mentioned that in terms of regulatory approvals, our regulatory authority cooperates, amongst others, with the Food and Drug Administration of the US and also with various other bodies in Europe and the United Kingdom. But I must hasten to say that SAPRA also does get from the WHO and also in other regions as well where there are regulatory authorities. So I think that there might have been some missing link in terms of what the participant thought it meant. But in no way, our plan, it's a wholly South African-made plan. We do learn from the experience of other countries who have already started the rollout. Just to give you an example, good and bad lessons we have to learn. If you look at the US, at some stage, the US distributed over 20 million doses of vaccines, but at some stage, only about 4 million of those had actually reached the recipients. So, those are some of the lessons which we are learning as we prepare our own platform. But otherwise, our plan is wholly based on the conditions of South Africa. And I can assure the participant that in no way are we influenced by, whatever plans were made in the US and any other country. Thank you very much.
Thank you, Minister. We will also take your advice and pass a few questions on. We have some questions regarding the opportunities for small business. And some of these the opportunities are there opportunities for small logistical companies to be involved in the process? Can government please create platforms for business to register and get accreditation to be part of the distribution process of vaccines and those that are not facilitated? I would like to know why we are not creating our own vaccine. And not sure if we'll be safe to function as normal. There was another question regarding the vaccine about what testing will be done regarding the vaccine rollout and how is the state assisting domestic business to establish capacity for production? I think the Minister would be best to answer this question.
Well, thank you very much. I think some of those also do overlap with some of the issues raised by members of the panel, opportunities for small business and also Black-owned businesses and women-owned businesses and companies. As Dr. Tulare indicated in her presentation, there are definitely going to be opportunities as far as storage as the consignment arrives. That one is very clear that we have an agreement with a company which is partly owned by the state, BioVac, which is a company which is specializing in vaccines. It's already been doing that work for many years. So as far as storage is concerned, BioVac will be looking after the receival of the vaccines, make sure that they are inspected, make sure that there are no defects and so on, and making sure that they are stored in a conducive environment in terms of the cold chain. But clearly in terms of the logistics of distribution, as Dr. Tulare indicated, where possible, because of the cold chain requirements up to a certain level, possibly, for instance, up to a province or up to a district, we are going to try as much as possible to have that as part of the contract of the supplier to maintain that cold chain. But it will not always be possible. Some of the suppliers may only want to commit up to the main storage, and from there, we probably have to get our own logistical arrangements. So in that regard, as the report indicated, there will be opportunities for private operators, logistical operators. And in that regard, I think the advice which you are getting, both from the panelists and also from these questions, are that we must not just look at the big companies, but we must also look at small companies. I think in that regard, it's a very timely warning because in that way, it means that through the various business associations, we're going to have to have very strong interaction so that the members of those associations who want to participate can receive information in advance in terms of the requirements, because this being medical products and specifically vaccines have very strict temperature requirements even during the transportation, right up to when they reach the recipient, the person who will be injected. So that information will have to be readily available and communicated with interested people, members of various business associations. In terms of, so I think the question of making sure that those companies are registered, I think that is the part which I think from our side, we're going to, in these various forums where we interact with business, it will mean that we must make sure that all the conditions are made available so that such interested business people can then have the right capacity and also make sure that they are properly registered. In terms of creating own vaccines, I think the President has also touched on this on a number of occasions, that even today, that at the end of the day, at the present moment, we're relying on what is available from other countries, but we're very conscious of the fact that as we will be procuring, we should also be creating capacity in South Africa for our own scientists and manufacturers, pharmaceutical manufacturers, to actually be assisted in research and in gathering all the information and capacity, so that going forward for the COVID-19 and also for other diseases and pandemics which are still going to come, we can have our own capacity to produce the vaccines. In terms of, I think, domestic production, I think...
Right, we're coming out of the Progressive Business Forum that has been discussing the economy and the COVID-19 pandemic, and just a summary of what Dr. Tulare said earlier when she was addressing the virtual meeting of this Progressive Business Forum. She talked about regulation matters about vaccines, that the major concern is that they must be safe. And she referred to the medicines and the related substances of Act 1 of 1955. And she also talked about the South African Health Products Regulatory Authority that has put measures in place to ensure safety of product procurement. And of course, she was talking about how the procurement will be done through the Public Finance Management Act of 1999, and also the emergency procurement procedures of vaccines that will be distributed, and it will be done through outsourced storage and distribution, and there will be a central distributor who will be also having contracted distributors so that there can be an even dispensation of the vaccines throughout the country at the health centers. And she also talked about the distribution that must ensure safety and security through vehicle tracking systems, and the South African National Defence Force will be deployed to monitor that process. And she then, for confidence building, talked about the rollouts of vaccines that have happened in other countries to assess the efficacies of these vaccines and monitoring, and government wants to ensure that there's vaccine confidence in the country through transparent vaccine safety, surveillance and causality assessment.